Hello, my name is Olusumbo, and I'll be talking about the structure and function of the eyes, the three types of eye disorders, their clinical manifestations, their treatments, and the nursing management. There are so many structures of the eye, but I'll limit myself to anterior chamber, the region of the eye between the cornea and the lens. It contains the aqueous humor, which is the fluid produced in the eye, the brooch membrane, which is located in the retina between the choroid and the retinal pigmented epithelium. The ciliary body is the part of the eye above the lens. It also produces aqueous humor. The choroid is the layer of the eye behind the retina. The cones is the photoreceptor nerve present in the macula. The cornea is the outer transparent structure of the front of the eye. The drusen is the deposit of yellowish extracellular waste produced in the retinal pigmented epithelium. The fovea is the pit of the depression at the center of the macula. The iris is the colored ring of tissue behind the cornea. It regulates the amount of light entering the eye. The lens is the transparent structure suspended behind the iris. The macula is the portion of the eye at the center of the retina. The optic nerve is the bundle of nerve fibers at the back of the eye. It carries visual messages from the retina to the brain. The photoreceptors helps light sensing nerve cells. The pupil is the adjustable opening at the center of the iris, and the retina is also light sensitive layer of the tissue that lines the back of the eye. The sclera is the tough outer coat that protects the entire eyeball. They have many eye disorders, but I will limit myself to cataracts and age-related macular degeneration and glaucoma. Cataracts, they are the opacity within the lens. It distorts the images projected onto the retina, and it also causes one to have blurred vision. The clinical manifestation of cataracts are decreased vision, abnormal color perception, glare at night. Sometimes there is no pain or eye redness when you have age-related cataract. Cataracts can be treated using surgery. So the doctor takes out the cataract from the eyes, and the patient has to be comforted. Before the surgery, they use an anesthesia to numb the eyes so that the patient doesn't feel any pain. The nursing management is assessment of the patient for distance and near visual acuity, and we have to make sure that the patient has all the information about the surgery, the consent form, the healing process, what is expected after the surgery, and what to do after the surgery. After the surgery, it is essential for the nurse to assess the patient's level of comfort and educate about the post-operative regimen. Another type of eye disorder is the age-related macular degeneration, AMD, and it is a deterioration of the macula. The age-related macular degeneration leads to is sometimes slow but progressive and might be painless. The patient might experience vision loss. And AMD, which is age-related macular degeneration, is the most common cause of irreversible central vision loss in people age 60 and over. Some of the predisposing factors are the person might be a Caucasian, has a family history of AMD, or have other chronic inflammatory conditions. A person that smokes or has hypertension might also be at risk for AMD. We have two types, the dry and the wet. The dry is age-related and it is an accumulation of yellowish deposits, which is called drusen in the retinal pigment. And the clinical manifestations are blurred and dark vision, decline in central vision, blind spots in the visual field, which is scotomas, distortion of vision, metamorphopsia. However, if only one eye is affected, the person may not notice the early vision changes. The other type of AMD is wet, which is very common and very severe, which can cause vision loss. Growth of new blood vessels in an abnormal location in the retinal epithelium. Treatment of AMD is ophthalmoscopy. Patients can also be prescribed eye medications like ranibizumab lucentis, bevacizumab avastin, aflibercept early, pegaptinib magugen. And all these medications are selective inhibitors of endothelial growth factor. The last but not the least is the glaucoma. And the glaucoma is a disorder characterized by increased intraocular pressure. The consequences are elevated pressure, optic nerve atrophy, peripheral visual field loss, and it is the second leading cause of permanent blindness in people living in the United States. We have the primary open angle glaucoma and the primary angle closure glaucoma. Manifestations are chronic angle closure in the glaucoma, and the patient might report blurred vision, colored halos around lights, ocular redness, or brow pain. Interprofessional care for all these diseases are comfort care and educating the patient to be aware of the risk factors of these diseases. And interprofessional care also include diagnosis assessment. The nurse should assess for the history of physical exam, visual acuity measurement, tonometry, ophthalmoscopy, slit lamp microscopy, gonioscopy. Glaucoma can be treated with beta-adrenergic blockers, alpha-adrenergic blockers, and cholinergic agents. Sometimes the doctor might recommend surgical procedure. People at risk of developing AMD, cataracts, or glaucoma should be educated about preventive mechanism by visiting the optician once a year so that they can assess the eyes and see if there's any changes to the normal functions of the eye. Thank you. Have a wonderful day. Bye.